Are you struggling to find the right long-acting insulin to effectively control your diabetes? Look no further. In this video, we will compare Tresiba and Lantus, two popular options in the market, to help you make an informed decision. When it comes to managing diabetes, long-acting insulins play a crucial role in maintaining stable blood sugar levels throughout the day. Tresiba and Lantus are both long-acting insulin analogs that work by providing a steady release of insulin over an extended period. Understanding Tresiba and Lantus. Tresiba, developed by Novo Nordisk, is a newer generation insulin that boasts an ultra-long duration of action, lasting up to 42 hours. It is important to note that the duration of action may vary between individuals. Tresiba is known for its reliable and consistent blood sugar control, minimizing the risk of hypoglycemia and allowing for more flexibility in dosing schedules. On the other hand, Lantus, manufactured by Sanofi, has a duration of action of around 24 hours. Lantus has been a trusted long-acting insulin for many years, providing effective blood sugar management for individuals with diabetes. Differences between Tresiba and Lantus. While both Tresiba and Lantus are long-acting insulin analogs, they differ in terms of their onset of action and flexibility in dosing. Tresiba has a more gradual onset of action compared to Lantus, which means it takes longer for Tresiba to reach its full effect. This can be advantageous for individuals who require a steady and consistent insulin release throughout the day. Additionally, Tresiba allows for flexible dosing, meaning it can be taken at any time of the day as long as it is taken at the same time each day. Lantus, on the other hand, has a more rapid onset of action, which may be beneficial for individuals who need a quicker response to their insulin. However, Lantus must be taken at the same time every day to ensure optimal blood sugar control. Effectiveness of Tresiba and Lantus in controlling diabetes. Both Tresiba and Lantus have been proven effective in controlling blood sugar levels and reducing the risk of hypoglycemia. Clinical studies have shown that Tresiba provides consistently lower variability in blood sugar levels compared to Lantus. This means that Tresiba may offer more stable and predictable blood sugar control throughout the day. Furthermore, studies have demonstrated that Tresiba may offer a lower risk of nocturnal hypoglycemia compared to Lantus. Nocturnal hypoglycemia, or low blood sugar during the night, can be particularly dangerous as it may go unnoticed and lead to serious complications. Tresiba's longer duration of action and more gradual onset may help reduce the incidence of nocturnal hypoglycemia. Side effects of Tresiba and Lantus. Like any medication, Tresiba and Lantus can have potential side effects. However, it is important to note that not everyone will experience these side effects, and they may vary in severity. Common side effects of both Tresiba and Lantus include injection site reactions, such as redness, itching, or swelling. These reactions are usually mild and temporary. Some individuals may also experience hypoglycemia, especially if the dosage is not properly adjusted or if they are taking other medications that increase the risk of low blood sugar. In rare cases, individuals may experience allergic reactions to Tresiba or Lantus. Symptoms of an allergic reaction may include rash, itching, difficulty breathing, or swelling of the face, lips, tongue, or throat. If you experience any of these symptoms, it is important to seek immediate medical attention. Choosing between Tresiba and Lantus. When choosing between Tresiba and Lantus, it is important to consider your individual needs and preferences, as well as consult with your healthcare provider. Factors to consider include your lifestyle, dosing flexibility, and personal experience with each medication. If you prefer a long-acting insulin with ultra-long duration and flexible dosing options, Tresiba may be the better choice for you. On the other hand, if you require a long-acting insulin with a more rapid onset of action, Lantus may be a suitable option. Your healthcare provider will take into account your medical history, current medications, and individual circumstances to help determine which long-acting insulin is most appropriate for you. Dosage and administration of Tresiba and Lantus. The dosage and administration of Tresiba and Lantus will vary depending on your individual needs and healthcare provider's recommendations. It is important to follow the prescribed instructions and consult with your healthcare provider if you have any questions or concerns. Tresiba is available in pre-filled pens and should be injected subcutaneously once daily. The injection site can be in the thigh, upper arm, or abdomen, and it is important to rotate injection sites to minimize the risk of lipodystrophy, changes in fat tissue at the injection site. Lantus is also available in pre-filled pens and should be injected subcutaneously once daily. Like Tresiba, the injection site should be rotated to prevent lipodystrophy. Cost comparison of Tresiba and Lantus. The cost of Tresiba and Lantus will vary depending on factors such as your insurance coverage, location, and pharmacy. It is recommended to check with your insurance provider and compare prices at different pharmacies to find the most affordable option for you. Some individuals may be eligible for patient assistance programs or savings cards offered by the manufacturers of Tresiba and Lantus, which can help reduce the cost of these medications. Patient experiences and reviews of Tresiba and Lantus. Reading about other individuals' experiences and reviews can provide valuable insights into the effectiveness and tolerability of Tresiba and Lantus. However, it is important to remember that everyone's experience may be different, and what works for one person may not work for another. Online forums, diabetes support groups, and healthcare provider recommendations can be helpful resources to learn about other individuals' experiences with Tresiba and Lantus. It is always recommended to consult with your healthcare provider before making any changes to your diabetes management plan. Conclusion and final thoughts. In conclusion, both Tresiba and Lantus are effective long-acting insulins that can help control diabetes and maintain stable blood sugar levels. Tresiba offers the advantage of an ultra-long duration of action and flexible dosing options, while Lantus provides a more rapid onset of action. When choosing between Tresiba and Lantus, it is important to consider your individual needs, lifestyle, and preferences, as well as consult with your healthcare provider. Together, you can determine the most suitable long-acting insulin for your diabetes management. Remember, diabetes management is a personalized journey, and what works for one person may not work for another. By staying informed, working closely with your healthcare provider, and making lifestyle changes as necessary, you can effectively control your diabetes and live a healthy, fulfilling life.